We know that for mismatch repair gene deficiency, so basically what happens is that if we have a DNA defect, then the mismatch repair enzyme comes in, correct it, and then DNA continues to replicate. So the same thing in cancer cells, right? So the cancer, when it's replication, something wrong with it, the enzymes come in, fix it, so the cancer continues to proliferate. So what happens is that when we have a deficiency in such enzyme, then the cancer cells really cannot repair itself really well. If we have an agent that sort of stop this kind of enzyme from working even better, then we kind of sort of stop the cancer cells from proliferating. So that's a whole concept that we know for patients who have deficiency in such enzyme, or tumors who have deficiency in such enzymes, their proliferation rate is not high because they keep having errors every time they replicate, right? So the mutation load for such cancer cells is very high. So we know that in the most recent New England Journal publication by Dr. Lee, that the mutation rate of such cancers is 1,500. In a normal colorectal cancer, it's about 40. So it's 200 times higher. And we know that immunotherapy, in particular from our experience, that seem to work better, particularly in cancer with high mutational load, right? The highest is melanoma, the second highest is squamous cell, non-small cell, the third highest is adenocarcinoma, non-small cell. So immunotherapy has been improved in all three categories, right? So the mismatch repair deficiency colorectal cancer is a category where we believe mutation load makes sense for immunotherapy to have some effect. So in the study that's published in New England Journal of Medicine, small number of patients, but very, very interesting, that all the patients who had deficiency in mismatch repair genes had a response. Actually, it doesn't matter if it's colorectal or non-colorectal. So now we're in an era where immunotherapy allows us to not really focus on organ-specific disease, but based on molecular biology, that it's very provocative, right? So the response was extremely high, and also, in fact, the progression-free survival have not been reached in the patient who have mismatch repair genes deficiency. So I think that immunotherapy definitely would be something very exciting for colon cancer, at least for mismatch repair deficiency subgroup. But even in others, we just, I think it's just a tip of the iceberg.